Moi, c'est Nadege Morette. Moi, je suis Milien. Moi, j'ai 27 ans. Pour avoir un bébé dans votre main? Ok. Pour faire une opération? C'est normal, moi, j'ai fait l'opération déjà. Ça va déranger. Mais là, il n'y a pas de gynécologue en attendant pour le moment. C'est parce que le docteur Milien, c'est un spécialiste dans le domaine.
I'm Dr. Milien Christophe, an OBGYN. I like this because it's my specialty. I like to do C-section. Since 2008 until now, I'm the medical director of LasCahobas Hospital. When I came here, we don't have the operating room. To be honest, I want to talk to you about Dr. David and Dr. Paul.
My name is David Walton. I am a practicing physician working in Haiti, and I worked in LasCahobas from 2002 up until 2008.
I have a patient who died during the transport to Kenj. This patient had the placenta previa, and this placenta previa makes this patient bleeding, and the patient is bleeding, and the patient is bleeding so high during the transport the patient was died. That was very dramatic situation. I used this situation to make advocacy, Dr. David, Dr. Paul, and I remember when Dr. Paul came here, he told me, what we can do.
That was a pivotal moment in which we knew that there was no other option. We had to do this. And so we reached out to some donors that had previously helped fund La Colline, and they made more donations so that we could put that operating room in place. You know, seconds matter, minutes matter, and that determines life or death for a woman who's delivering, who has a complication.
Et puis après, j'ai fait une opération déjà qui fait me faire césarienne. Je l'ai dénommé Christophe, j'ai 28 ans. Oui, si je accouché là, j'ai un gros problème qui arrive. Ma tête est cachée. C'est grâce à eux-mêmes parfois qui fait qu'il y a une femme qui va mourir.
Our ability to put that operating room in there, and again, operating room is probably a strong term. It's really a procedure room. You know, has truly saved lives. You know, but of course, Milien is the architect of that initiative.
Mission.
Women's health is such a critical component of what we do. We wanted to do, and eventually did, is create the second freestanding women's clinic in central Haiti. We truly encourage more and more women to deliver at LasCahobas. We've been successful, and our success is measured by deliveries per month.
In 2008, the number was about 18 deliveries a month, and after we have about 120, 110 deliveries.
But again, there's ebbs and flows, and sometimes it's truly overwhelming, and you know, it's difficult to keep up.
Il y a une infirmière sage-femme, il y a une infirmière circulante, il y a un obstétricien gynécologue et un anesthésiste. Ilabelle Natacha, infirmière sage-femme, à cause de tremblement de terre qui était passé en 2010, ça a fait qu'il y a plus de monde qui était habité dans la zone LasCahobas, il y a plus de présentation. Ça a toujours été même quantité, mais on a toujours venu plus dans l'hôpital.
But I think the Mirebalais team will be very helpful. The Mirebalais hospital they build now will be very helpful because a lot of populations will go back to Mirebalais. I wish that a lot of population will go back to Mirebalais.
We have a laboratory, also a pharmacy depot. On this side down here, we have vital signs.
We have a huge absorptive capacity with this hospital. Mirebalais will have 6 operating rooms. One is probably solely dedicated to C-sections and or elective GYN surgery, and we have a ward dedicated to post-GYN surgical care. So again, it is the next step in terms of being able to afford women these services, the service that they've been asking for and that they truly deserve.
lié des familles à contrôler tête à faire petit pour pas faire plus petit.
Thank you PIH, thank you the American population and all people who give us this possibility to provide healthcare to the poor population. Thank you very much.
Thank you, Milien.
Yeah.